everyone, I'm Terry. So today I'm going to explain and talk about the medical conditions in the LA County Jail, which um, just as everything else, they're notorious for. And I'm going to describe it as I did yesterday in my other vlog from two different perspectives, which is different because probably any other blogs that you've seen about county jail and state prison, it's always described from the perspective of a general population inmate only. So this one's a little more rare. What I'm going to do is I'm going to discuss it from the perspective of a general population inmate and also from a different perspective, which is of mine when I was there, which is an absolute solitary confinement inmate, or in other words, a K-10 inmate, which is what they label you if you're there on administrative segregation. And they did this with me because, as I said before, forever ago, I had a lawsuit against them. And ever since then, every time I've been arrested and put back in there and incarcerated with them, they've always retaliated by unnecessarily putting me in solitary confinement and labeling me a K-10, which is something permanent that they've done with me. So they have my name in the system and they automatically just chain me up and take me to the K-10 floor and put me in a cell by myself, which is not always a bad thing because the conditions in the LA County jails are absolutely filthy and really, really unhealthy, and it can also be harmful depending on what's going on in there at the time, like staff or anything else that they have going rampant. So rampant. And they're always talking about the lawsuits that they have, and they have quite a few, you know, ACLU, when ACLU chooses to take on an inmate's case, which is always a class action case, what they do is they make amendments, but those amendments are never kept up with. They're never instituted consistently, and it would take either that original inmate or another inmate to contact the ACLU and then actually get a response from the ACLU and pick it up from there, which not very many inmates do, unfortunately. So the medical conditions, like everything else in the LA County jail, is notoriously, it's all notoriously bad. Okay, so they have a procedure which they've had for a really long time where when you need to see a doctor, they will give you a triage form, and that's the initial form that you fill out. I believe it's on a duplicate or a triplicate, so you get to keep a copy of it and you hand that in, and within, I think, 48 hours, I'm not sure, I don't remember exactly, but within a certain amount of time, they're supposed to have a nursing staff, and that's not always an RN. It's most of the time it's an LVN or another division of the nursing staff triage you on that, and they don't always do it on time within the time constraints that they're supposed to. At any rate, they do have you triaged, and then it takes forever from there to see a doctor depending on the severity of your medical complaint. So even, you know, for a healthy person, it's absolutely difficult. But if you have a chronic condition like diabetes type 1 or 2, asthma, if you're pregnant, and a variety of other chronic conditions, chronic acute, just acute, it just gets worse from there. Just about the only way to get, you know, the definition of an emergency type of attention is if you fall out, and, you know, probably most inmates, when they need something minor, they actually do, you know, they pretend to fall out, and sometimes it's actually justified. to do this. It's manipulation, but in those jails, manipulation is the only way you get what you need, and you take it from there. So if you're in there for a while, or if you've been in there enough times, then you know that there's a way that you have to get around it, because they don't do things properly or legally most of the time. So it's really, really difficult unless you come across a decent employee there, which can happen, you know, most likely it doesn't. I've had an experience with decent employees, and most of the time with horrible employees. And that's not just the sheriff's staff, but it's the medical staff. Now, um, as a general population inmate, again, so you would fill out the initial required form, you'll get triaged, when they feel like triaging you. And then if it's something minor that's a quick fix, like maybe, aspirin that you can't buy from the commissary because you don't have the money, or you haven't had a chance yet, or whatever reason, if it's a band-aid or band-aid fix, you know, um, something minor, then maybe the nursing staff will just give you that, and that'll be the end of it. If it's not, and it's more involved, then they'll schedule you to be seen by a doctor, again based on how they prioritize you. So, you know, uh, again, the nursing staff really determines a lot of these things. It's not always um, your condition that determines it, which is not good, because you can have a really severe condition and the nursing staff won't see it that way, or maybe just chooses not to. So it'll take you longer to see an actual doctor. And the doctors there, not all of them are absolutely competent. There are some actually really good doctors there, which is a rarity, but I've run across some pretty decent doctors that are working there for whatever reason that they have for working there. Now, if you're a solitary inmate like me, and that always becomes more difficult, and with me it became complicated because they also, part of their retaliation, in addition to having me confined from the general population, by myself, to make it worse, is that they followed me everywhere with a video camera, which they uh, falsely claimed is because, of allegations, but that was never the case, because any complaint that you have goes on a complaint form, and they allegedly investigated there. So I don't think they were ever worried about allegations. I mean, if you're worried about allegations, then you're doing something wrong. And with them, I think that was more the case. They knew they were always doing something wrong. At any rate, so why they handled me that way with a camera, solitary confinement, sergeant escort, was just to harass me. And sometimes they would actually get a rise out of me, because on some days it just became too much, and I would fight them back on it. Other days I would just go along with it. So for me, the procedure was initially the same, where I had to fill out a form, hand it in to a nursing staff, or throw it in the metal lockbox in the unit where I was confined. I call it a cell block. They call it a pod. Um, call it what you want. Anyways, to me, it's always a cell block. And then I would eventually get triaged. Now, with me, I'm 100% healthy, always have been. However, being in that type of environment, I always had some kind of physical reaction. It's a really bad environment, especially if you're used to being in a good environment, and you go from that clean, healthy, uh, better environment to something like that. It's a huge difference, and And it causes reactions in your body, and sometimes it is in your mind, because I mean there were times when I was sure I had an ear infection or sinus infection, um, and uh, it wasn't quite that severe. And sometimes it was. I do react with allergic reactions. I do react with ear infections in there. Sometimes from going overboard in scrubbing my ears, or uh, there's a variety of reasons. So there have been times when I felt like I had a really severe um, reaction and or condition, to where I was just out. I mean, it felt, I mean, I hate to say this because I've been through worse, but when you're in it, it feels like it's the end of the world. And when they don't want to give you the medical attention that you need, and it's never for attention, it's for getting something taken care of that you really feel has to be taken care of. And where they're not doing that for you because they're spiting you, um, you feel like it's even worse than it actually is. So I'm gonna admit, sometimes in my head, I think I made it much worse than it actually was, and I felt like, oh my God, I'm never gonna get better. I'm only gonna get worse. And sometimes it was pretty bad. You know, um, Having strep throat, that's bad. So most of the time they would not give me the medical attention even within the time constraints, or a nursing staff would come and take my blood pressure, and if, because I was stressed out and I had anxiety, if my blood pressure was extra high, they would just say, oh, you'll be fine, and that would actually make me panic, because I'm really in tune to myself physically, and so it makes it worse. And they wouldn't do anything about it, and I would walk or run to the door of the cell block, and they would tell me go back in the cell, and I wouldn't go. And sometimes I would urge them for care, and sometimes I would demand it. There were other times when they would actually threaten me that if you don't go back in the cell right this minute, you're going to go to the hole. And there were some times when they actually dragged me to the hole, and I would fight them on it, and they would drag me to the hole. And everything was on camera. And once I was in the hole, it was one of the worst feelings for me. To be in the hole in LA County Jail is to really be in a dungeon, and these are cinder block cells. They're concrete slabs where you can put well, they give you a gym mat. They don't give you an actual mattress, so you get a gym mat. Um, uh, Most of them have the traditional metal bunks, so it's not always a concrete slab. Either way, I mean, that wasn't even the most difficult part. The most difficult part was that I couldn't use the phone once they threw me in the hole, and sometimes they would literally throw me in the hole, and I would fight them on that, and they would throw me in there. I mean, it's one of you, and it's about, maybe, I don't know, maybe 5, 6, sometimes 10 of them. These assholes, they don't go one on one because they know better. So uh once you're in there, of course, you can't use the phone. You can write all the complaints you want. It doesn't help. If there's something, a pressing legal matter that you have evidence of, then sometimes they let you on the phone. That's about it. And really, even if I was able to get on the phone, I don't think there was anybody who would help me. So I was always on my own in there, and left to my own devices. Um, and being in the hole, it's up to you to just be strong and get through it, however way you have to, manipulation, or just getting through it, or doing it, or whatever you have to do. There are trustees in there, and those trustees really, they have a I don't really like this word God, but they have a God complex because they tend to get favored and they're rats and snitches. So they're inmates, but they're not always on the inmate side. Sometimes they are, sometimes they help out. You find some cool ones, you find some not cool ones. But it's also been the same for me with the, you know, with the sheriffs. Um, there have been a couple cool ones down there who, they were nice to me, I guess I can say, or they were okay. They didn't go out of their way to make me miserable, and the rest did. That's how it was, you know. So being down there, I got to a point where I just, you know what, I took it like a man. I had to, and I soldiered on and I got through it. And when my time was up, they take me back upstairs to the K10 cell block, and you have to start all over again with property, with um, everything. Whatever you've accumulated, in my case at any rate, I have to reaccumulate. You have to do what you can do to make yourself, I won't call it comfortable, but you have to adapt. Adapt and survive. Because in there, for most inmates, it's about survival. And for some, it's fun. It's their party. For me, it never was and it never can be okay. It's something that I had to adapt to and you know get through. At any rate, the medical conditions in there are still to this day really bad. Um, Most of the time, you won't get the right medical help. You will get enough to live, and that's relative. I mean, it used to be a long time ago where diabetics, for instance, would get a diabetic special diet. They would get um, an extra little snack, you know, to level out blood sugar levels. But now they don't really do anything. They've taken away the diabetic special diets, as far as I know. So diabetics type 1 and 2, anybody with a chronic condition, um, almost basically just eats what every other inmate is served. And as a snack, though, they do still get snacks, but here's the thing: their snacks consist of whatever they have on hand, which is chips, glazed donuts, prepackaged, lowest quality, glazed donuts, cookies, bread slices, orange juice, fruit punch, which is just syrupy colored sugary water. And the water content, believe it or not, is actually lower. It's the ratio is terrible. You get more syrup and more color than you get actually filtered water in these drinks. Uh, and that's what the diabetics get, whether you're type 1 or type 2. If you require a snack, um, things can go wrong in there. Your condition can change. It can become exasperated. They give you whatever they have. They don't give you uh, fruit or vegetables or what's better for a diabetic. They give you whatever is there. And sometimes some of the nurses, their intentions are not bad. Some of the nurses are actually nice, and if they are good with some of the inmates who have a condition, and they come to, they come for an insulin call early in the morning or in the afternoon or in the evening, they have on their little cart um, a bucket. It's a bucket, it's like a hospital bucket with whatever things are left over from the lunches, from the bag lunches, and from the bag breakfast, which is, like a glazed donut, a Dolly Madison knockoff, things like that, or Fritos, whatever, like I said, orange juice. And they'll just give them a bunch of those because it makes the inmate happy. Um, these inmates, they're not educated about their conditions. They come from the streets, they come from They come from backgrounds that don't afford them, the knowledge that they need, even for their own sake, or they don't bother. I mean, they have addictions. They're coming in with the addictions, and there's drugs in there, so they continue with their addictions. They really don't care. So the level of care that you get in there, if you are ill, is just enough to keep you from dying, and that's not good, because you come in there and you're worse off than you were before. I see inmates with um, psychological problems or just emotional problems, and there's a difference. There are inmates who come in there, these are stable women that I've seen, but during the intake process, maybe because it's their first time or for whatever reason, they don't know any better. So when they're answering questions, in processing downstairs, and they tell the nurse, yeah, I'm scared, I'm stressed out. These nurses too are not the most educated. They've taken enough hours to become certified. That's it. So what they do is they refer them to a psych staff, and the psych staff puts them on some kind of medication. If they say they can't sleep, they don't necessarily just give them something to help them sleep or put them in a different area of the jail. No, they'll stick you in the psych pod, cell block, which is what I call it, and they'll give you medication, which you're not forced to take, but they give you medication that can really flip you inside out. I've seen normal women, what I would call normal or stable, at an okay operating level, come in there and just say during the intake process, I can't sleep, or I'm worried, or I'm scared, or whatever, it's my first time, and they put them on the wrong medication, which causes these women to lose their minds. I've seen some women rip their clothes off and run through the cell blocks. Um, and I've seen this because when they've been escorting me from one location of the jail to another, I've actually seen these things happening. And I remember the inmate because I was in intake with her. And she was okay. And now all of a sudden she's not, she's absolutely um, loony. So you're not in good hands there. It's really up to you to learn the way, and you have to learn it quickly, and to know what to do to advocate for yourself, and to sometimes know that answering something honestly and accurately could cause you more problems than not. It's really a balance that you have to maintain, and not all inmates know that, male or female. If you don't know the system, if you're not used to it, you don't know any better. So it can be harmful, but to degrees. It can be mildly harmful, it can be uncomfortable, and it can be horrible. And they do have 4 points there, which is they have restraints where they will put you in your wrists and your ankles in straps, and you'll be confined to a metal slab. No mattress, nothing, in a gunny sack gown, because they feel like you can't rip those. They're actually quilted, but not for comfort. These are filthy gowns that have been used over and over, and they're just kept together by a little bit of Velcro. And then when a doctor comes and speaks with you and asks you a couple questions and feels like you've stabilized again, they'll get you out of restraints. You go back to the psych pod, and then you can graduate yourself into general population again. The psych pod is not solitary. You're just in there with the other inmates. So it's almost like general population, but you're in there with inmates who are on medication. Um, that's a basic overview of the medical conditions and the medical process in the county. And state prison is not that it's better, it's actually not. You have the same type of medical staff there too, the same mentality, and they too have been faced with lawsuits. Many times they made amends and they don't keep up with them and they slack off, and so the medical conditions in the state prisons in California are also um, just as bad. It's just that maybe they will triage you within 72 hours, which is their time constraint. And for the most part, they stick to that. You will get triage, but again, it takes forever to see a doctor. Yeah, it is due to the overpopulation, but it's also due to a really sluggish um, medical system with the jails and the prisons. So, really, I think the most part is you advocating for yourself, knowing what's available, and availing yourself of that. And that's all in how you speak with them, how you interact with them when they do see you, um, what you tell them, and how you tell them. You know, most of this is actually determined by you. You don't think so, you don't think you have much control, and you do and you don't, but you can direct it in a certain direction, and that's really how it goes. And I hope this sheds more light for people who may be facing a sentence or a stay there, to put it mildly, or just because you just want to know, or even for entertainment purposes, because there's all kinds of people out there. Thank you, and hope you have a great rest of the weekend.